Hello, my name is Dr. Mohiba Tareen. I'm a board certified dermatologist and I practice in Roseville, Minnesota. We are going to do a little video today about a procedure called Kybella. Kybella is also known as deoxycholic acid. It's a medicine that's injected into the skin, particularly this extra layer of fat that some of us carry in our neck, and it breaks up those fat cells. It causes our body to absorb it, and those fat cells are gone forever. I've actually had Kybella myself because I had some little resistant pouches of fat, and I'm about 7 months pregnant right now. And despite gaining weight in other places, my fat cells in my neck have not come back. And this is my 5th child, so I usually get a pretty big fat face by this time in my pregnancy. And luckily, because of my Kybella, this has not come back. The nice thing about Kybella, other than that it is permanent, is that it is not surgical. So you don't have to go through liposuction, you don't have to go through an operating room procedure. The other great thing about Kybella is that both men and women do it. And in my practice, we've done thousands of injections. We've done it equally for men and women, and everyone seems to be very happy with it. Kind of the downsides of Kybella, that you do have to go through a few little injections, but they'll be quite comfortable, as you'll see in the video. And then also you can get quite a bit of swelling afterwards. And that swelling is actually good. That is that medicine, that deoxycholic acid, breaking up the fat cells and having your body having an inflammatory reaction so that your body absorbs those fat cells. So the swelling, which I definitely experienced after, and then we'll give you some photos of Marcin after, the swelling is actually a good thing, and it should be viewed as a good thing for your subsequent improvement. So this is my friend and patient, Marcin. He's obviously in great shape, nice and slim and trim and muscular, but he just has this little pocket of fat right here. And that is resistant to diet and exercise. Like, how are you supposed to exercise your chin, right, Marcin? So what we are going to be doing today are these little Kybella injections and that little extra layer of fat. It'll go away, and then we'll see him back in about 6 to 8 weeks, and things should be much better. Ready, Marcin? So we did a little bit of numbing of the skin. Now my colleague Rachel is going to use that little roller that you see. That actually is a cold ice roller that helps also make the procedure very comfortable. And I'm going to place the Kybella injections directly into the fat cells. So Marcin, you'll feel a tiny little pinch and then that little bit of needle deeper in your fat cells. Sounds good?
Okay.
So the area has already been cleansed. You can see I use tiny, tiny, tiny precise needles. And that's why I really recommend, dermatologists, plastic surgeons, we tend to be the best at Kybella because we're used to doing injections all day long. So I'm going to begin right in the middle, kind of where we all have the bulk of fat. Ready, Marcin?
Mm-hmm.
First little pinch. 1, 2, 3, pinch. Doing okay, Marcin?
Yes.
Pinch right there. You can see how precisely I'm going right into that little area. And really deep, because the fat is deep, and I don't want to cause any problems to the skin. Immediately, Marcin may feel a little bit of burning, and that actually will continue to get a little bit worse over time, as we discussed, but it's not unbearable. How's our burning on a scale of 1 to 10, Marcin?
2.
Good. But you can definitely feel something, right?
Oh,
So I was definitely not injecting water into Marcin. So we're about 1/5 of the way through, Marcin. Great. Look for me for a second, Rachel. Perfect. Now I'll go to the red. Perfect. So Rachel's just holding pressure right there to give some support. That also makes the skin feel better with that burning phenomenon. We're going to do our next line, Marcin.
Okay.
Ready, dear?
Mm-hmm.
Pinch right there. Ready, Marcin?
Mm-hmm.
And Rachel and I can tell you, of those thousands of injections, have we ever had an unhappy patient?
Everybody loves it.
Right. Good job, Marcin. Marcin, how is that burning at this time now?
A little bit higher, but it's fine. Nothing serious.
It definitely, continues to escalate, and just as Marcin described, it's nothing too serious. You feel it. Speaking from somebody who's had it myself, you feel it, but I embrace it. Okay, ready, Marcin?
Yes.
Pinch right there, sweetheart. And Rachel and I have developed a technique where we kind of feather it along. We have such great success because it just gives that natural contour. People are loving how their neck just looks natural, but much more firm. Perfect. So now I'm going to do these little lines right there. More than 2/3 done now, Marcin, okay?
Okay.
Look for me for a second, Rachel. Perfect. So 1, 2, 3. Perfect. So it's both an art and a science doing it because we really want to target all those fat cells, but we want to do it kind of in this tapering, gradual manner so it looks natural. Ready, Marcin?
Mm-hmm.
If injected by an inexperienced injector, Kybella can cause death to the skin cells. Pinch up there, Marcin. It can cause other nodules and things like that, so it's really important that you have a very experienced injector do your Kybella injections. This is our last syringe, Marcin, okay?
Okay.
Ready, dear?
Mm-hmm.
He is a rock, man. Not all of my patients are this impressive, but Marcin definitely is. Perfect. Done. We are now done with our Kybella procedure. Marcin, how is it feeling now?
It's numb
No.
and
Good.
like really burning.
Good. So Kybella is a great adjunct to another procedure called cool sculpting, where actually a cold laser is used to destroy the fat cells. It really depends on how much fat you have and where those fat deposits are. Sometimes if there's a lot of fat, what we'll do is we'll do the cool sculpting first to debulk the area, then we'll kind of just fine tune and make everything perfect with the Kybella. If you're, in great shape and have not too much fat, like Marcin just had that one little resistant pouch, he was a great candidate just for that Kybella. Same thing with me. I just had a little bit right there that bothered me, so instead of doing the cool sculpting everywhere, I just did the Kybella in my pouch, and I've been pretty happy with it. Thank you so much.